1 cent for every dollar of care provided. Medicaid pays 88 cents for every dollar provided. So the cuts in Medicaid, which also have been discussed as an expansion, and the cuts in Medicare, which we're talking about possibly expanding, would go forward, which means what? The Hospital Association knows what is rural hospitals that care for Medicare patients are going to go under. So what kind of services can be provided if there is no hospital in a whole county that can provide care to these senior citizens? So I asked the senator from Arizona, who's been such a leader on this, we're going to cut $135 billion out of Medicare coverage for hospitals. We're going to now talk about expanding the coverage of more Medicare patients, which will mean we're going to cut more from the hospitals than is even envisioned in the underlying bill. Help me understand this, Senator. How would you suggest that that passes the common sense test?
May I say, having stood fifth from the bottom of my class at the Naval Academy, I am an entire loss to explain that to the senator from Texas. Perhaps before I turn to the senator from South Dakota, maybe we could get a response from Dr. Coburn to that question.
They're not. They're going to cut care, which means you're going to have more complications, which means you're going to have worse outcomes. That's what's going to happen. And rather than changing the payment formula, which is really what we should do, by rewarding quality and rewarding outcome, rather than rewarding, flipping a switch, that's what needs to happen. But we're going to take the same antiquated system, we're going to cut $465 billion from it, and then we're going to add, and my colleague from Tennessee, correct, it's 34 million people, if they include everybody from 55 to 64, into the same program.
Is the senator saying that whether you were at the top of your class, like the senator from Oklahoma, or the senator from Tennessee, or the senator from South Dakota, or the bottom of your class, as the senator from Arizona has admitted he held down the fort, regardless of where you are on the quotient of where you stood in your class, you know what the bottom line is?
Care is going to be impacted. If the senator would allow me, just real short, here's a survey of 90,000 physicians. 90,000, that's more than the active practicing physicians of the AMA. Here, what do they say? More than 8 in 10 physicians surveyed, they think payment reform and med-mal reform are the best policies for physicians and patients to improve the system for all Americans. Only 5% of the physicians surveyed rated current government health care program as effective. 5%.
Well, I would just ask my colleague from Arizona, because if this is what happens when you end up with one-party rule, one party trying to do this, go it on their own, because this seems to be a model of dysfunction in how to come up with a solution to one of the major problems facing the American people. And dysfunctional even by, I say, Washington's twisted standards, but they just seem to be desperately throwing things at the wall, hoping that something will stick. But surely there has to be a better suggestion coming from the other side than to expand a program that is destined to be bankrupt in the year 2017. I mean, it's the equivalent of a ship that is sinking. It's like the Titanic. You're going to put more people on the deck of a sinking ship. And clearly the overall objective, at least among some, and I think some of them have been transparent about it. Someone quoted earlier today the congressman from New York and the other body who said that this is the mother of all public options. He went on to say, never mind the camel's nose. We have his head and neck in the tent on the way to a single-payer system. And so obviously there are some people here who really want to see a single-payer system. They want to see government-run health care. We don't happen to believe that that's the best solution for America's health care system. But the amazing thing about this proposal is that it takes a program that is destined to be bankrupt in a few short years, cuts $1 trillion out of it over 10 years when it's fully implemented, and then adds a whole millions of new people into that program. I mean, it's hard to come up with any rational explanation for what's going on here, other than that they are left with just in desperation trying to throw something in the wall, hoping that it will stick. And so I would say to my colleague from Arizona, is this typically what happens around here when one party tries to go on its own on something that is this consequential to America? 1/6 of our economy is represented by health care in this country, and essentially what they're saying is that we want to expand the part of that economy that isn't working today, that's headed for bankruptcy, that under-reimburses doctors and hospitals, put more people into that failed system, exacerbate the cost shift problem by forcing the people who in the private payer market to pay higher and higher premiums. It just seems like this creates all sorts of problems that make matters even worse. And so I would say to my colleague from Arizona, I appreciate his leadership on this issue in pointing out what inevitably is going to happen. And when you have, as you noted, the Washington Post editorial this morning, even acknowledging the terrible problems that this creates for health care and the way that this is being conducted, the sausage being made here in Washington, D.C., that I would say again, even by the Washington's twisted standards, this process has become so dysfunctional, I don't know how they can recover. But one thing that they could do is decide to sit down with Republicans and actually figure out some things that we could do that would drive health care costs down in this country rather than make them go up, I would say to my colleague from Arizona.
Well, I thank Senator from South Dakota. I have to say that I have never, in the years that I've been here, seen a process like this. I mean, it is incredibly bizarre that after a year, after hundreds of hours in the Health Committee, after how many hundreds of hours in the Finance Committee, products are here on our desk, 2,000, it's in front of the Senator from Tennessee's desk, and yet there's a meeting yesterday of the Democrats, and they come out and they don't know what the proposal is either. Apparently, there's only one senator that knows what the proposal is, and that's the majority leader. Now, and also then it's okay to go home for the weekend. I honestly say to my colleague from South Dakota, I've never seen anything quite like this, especially when we're talking about 1/6 of the gross national product of this country. And of course, already from what they know, the health hospitals and doctors and others have come out in strong opposition to the expansion of a program that the senator from South Dakota points out is going broke. It's going broke. Senator, Republican.
Well, I'd say to my friend from Arizona, he made reference today to the senior senator from Maine and her very insightful and thoughtful and correct speech a couple of weeks ago about how an issue of this magnitude was historically dealt with here and how it was not being dealt with this way. I mean, she pointed out that the major domestic legislation in modern U.S. history was, without exception, done on a largely bipartisan basis. And that whole process, as the senator from Maine pointed out, has been entirely missing as we've moved along here toward developing of this 2,074-page monstrosity of a bill designed to entirely restructure 1/6 of our economy on a totally partisan basis. I don't think that's what the American people had in mind. And so they want us here, as we've all indicated, debating, discussing, and amending this proposal, and that's what we'd like to do for as long as it takes.
If the Republican leader will think back when he first came to the Senate as a young aide in 1969, the year before I was a young aide in the Senate, and I can remember President Johnson, a Democrat, Everett Dirksen, the Republican leader, dealing with the open housing legislation in 1968, a very controversial bill. How did they do with it? The Democratic president had the bill literally written in the office of the Republican leader with staff members and senators trooping in and out. The country looked to Washington and said, well, the Republican leader and the Democratic president both think it's important. They're trying to work it out. And in the end, they voted for cloture, and in the end, they got the bill.
My friend from Tennessee is entirely correct. And right before we got here in 64 and 65, Democrats had overwhelming majorities, as they do now. The Civil Rights Bill of 1964 and the Voting Rights Bill of 1965 passed on an overwhelming bipartisan basis. The leader of the Republicans, Everett Dirksen, was every bit as much involved in that, if not more involved in it than even the Democrats. Republicans supported it on a percentage basis. A greater number of
Minority time has expired.
I ask consent for one more minute.
Without objection, so ordered.
An even greater percentage of Republicans ended up supporting the civil rights bills of 64 and 65 than Democrats, but it was a truly bipartisan a landscape for our country, a landmark, important. And it was widely accepted by the American people because of the broad bipartisan support that it enjoyed. That is what's been lacking here from the beginning.
Mr. President, I ask unanimous consent that a list of the physician organizations that oppose this act, representing over 1.5 million physicians, be included in the record.
So without objection,
Thank
so
the
ordered.
senator from Montana for his courtesy.
Mr. President.
Montana.
Mr. President, I must say that some of the debate on the other side of the aisle is a little surreal. They say they want to